Hello, everyone. This is your host, Susan Rosen. And today my guest is Dr. John Neustadt. And he is a naturopathic doctor. Is that
That
right?
is correct.
ND?
Yes.
Okay.
Hmm.
Okay. I'm never sure that I know I know that, never mind. He is the founder and president of Nutritional Biochemistry, Inc. Dr. Neustadt earned his naturopathic medical degree from Bastyr University, which is a very well-known and respected place of education, where he was awarded the Founders Award for academic and clinical excellence. And Dr. Neustadt has published more than 100 medical articles written for as in the number, health and wellness books, and is now a #1 Amazon best-selling author in the field of osteoporosis, which we will be talking about. His most recent book is Fracture Proof Your Bones, a comprehensive guide to osteoporosis. And Dr. Neustadt was also an editor of the textbook, Laboratory Evaluations for Integrative and Functional Medicine, which was used across the US to train and educate physicians on using functional medicine with their patients. And he is here to talk to us today, mostly about osteoporosis, but there'll probably be other things that'll kind of come in from the sidelines. So
Sounds great.
welcome. And
Thank you.
I'm assuming you don't mind if I call you John and not
No,
Dr.
that's great.
Neustadt.
And I would just like love to add to my bio that wasn't
Yes,
mentioned. I'm
please.
also on the corporate advisory roundtable for the Bone Health and Osteoporosis Foundation, which was previously the National Osteoporosis Foundation, but they
Okay.
rebranded last year. And I'm the vice president currently of my state
All
medical
right.
association.
Great. Great. And that's, I assume, is that just a US organization or is it international?
The Bone Health and Osteoporosis
Yeah.
Foundation is a U.S. organization.
Okay. Okay. Interesting. Okay. Um, so we were talking a little bit before I turned on the record button. And we were talking about how the majority of people who get osteoporosis are women, which I think everybody kind of assumes, but that there is a certain percentage of men who get it as well. And so we'll talk about that a little as we get, into the program. So why don't we start off by talking about what, if there are age areas where it's for women in particular, that are higher, where the risk goes up, and why that is.
So the majority of cases
Mhm.
are in what's called postmenopausal osteoporosis, which
Oh,
occurs, as the name indicates, in women as they go through and are postmenopausal. The fastest rate of bone loss is during menopause and for the 10 years after. Now, as we're growing up,
oh,
we're babies and we're going through our teens and our 20s. That's the time in our lives when bone reaches their maximum bone density. And then from about the age of 30, 33, or so on,
mhm.
bone, we start to lose bone minerals or bone density.
Okay,
Now, that's an
okay,
important point and distinction because people have probably heard about a bone density test. A bone
mm,
density test only measures the mineral component of the bone. But as we'll get into, I'm sure there are other
oh,
important parts of the bone that contribute to bone strength. It's not just the minerals. But as
okay.
women get older and as men get older, that's when the increase for osteoporosis and most dangerously, osteoporotic fractures increases.
Okay, okay. Interesting, interesting. Yeah, I think, and I'm just guessing because I have not done a survey to find to, you know, to say that this is one way or the other. You probably can correct me if my assumption is incorrect, which is that most people, unless they actually closely know someone who's had osteoporosis, don't really understand that much about it. They know about it on a general level. They probably know that women get it more often than men. they probably know the ages, right? But that's probably the end of their knowledge, unless, like I say, unless they know personally someone who has
And
it.
you're right. One of my missions and passions is speaking on this topic and educating people and raising awareness about it. There is an osteoporosis awareness month that occurs in May, but there aren't
Oh,
campaigns like breast cancer where you've got the pink ribbon or big budget marketing
yeah,
pushes
yeah.
to raise awareness for this.
And
This is a
money.
and money. This is a silent disease that typically doesn't have any symptoms until
Mm-hmm.
suddenly somebody breaks a bone. That is frequently the first sign that they have osteoporosis. And
Mm-hmm.
oftentimes, despite the recommendations from the US Preventative Services Task Force and other medical organizations that women should get screened with a bone density test for osteoporosis, the vast majority of patients who are eligible to get screened are not getting screened. And so what happens is they break a bone, and then that oftentimes is the indication, and the doctor say, oh, well, let's get a bone density test when it's too late. That bone
Yeah.
density test should have been done years before. And
Uh-huh.
so it is a silent disease. There isn't enough awareness about that. And I thank you for having me on your program, because
Yeah.
I'm hoping to do my part to raise this awareness, because it is a deadly condition. If every 30 seconds somebody with osteoporosis somewhere breaks a bone, if you have osteoporosis and you break a hip, there's up to about a 36% chance that you're going to be dead within a year. And if you survive that, about half of those people who survive never regain their full level of pain-free mobility to enjoy their life that they had before. And in fact, if you're a woman who's 45 years old, your risk for breaking a bone due to osteoporosis is actually greater than your combined risk of breast, uterine, and ovarian cancer.
Wow.
But people aren't aware of it. And I hope to shine a light on this. And not just shine a light, but help people understand what they can do.
Yeah. Well, and starting from that point, what are because the numbers have to be going up then after that, right?
They
I mean,
are.
getting worse and worse. I mean, you get through that age, and then maybe you hit 50 or you hit 60.
Correct. And the population is aging. There's now more people over the age of 65 around the world than younger than 5 years old. And so we're looking over the next 10 years of a tsunami, a tidal wave of new cases coming along. And unfortunately, people aren't getting screened. There was one study that showed that 95% of Medicare patients who are eligible for screening weren't getting a bone density test.
Really?
And there's no
Wow.
specialty that is just for this disease like there is for cardiovascular disease or kidney disease. There isn't. And so it's the general practice physician and general practice doctors who are the ones who are the first line at screening with this and ordering these tests. They're not ordering them. They don't understand largely what the indications are for ordering the test, who should be screened and when. And then there's a lot of confusion about what to do even with the test results, how to interpret them and apply them.
Okay. Interesting. Yeah, I know my husband and I are both Medicare and belong to Kaiser. I'm sure you're familiar being in California,
yes.
that you're
Kaiser's an
familiar with
excellent
Kaiser
system.
Yeah, and you don't have well, you always have a choice, right? But they set you up. It's just on a regular basis. They tell you, okay, go make yourself an appointment. You're due for the
Kaiser
screening.
is one of the better systems, I believe, in the country for doing that. And they tend to be more attuned to preventative medicine and preventative testing, as is my understanding.
Yeah. And I hate to, maybe I shouldn't say this on a recorded thing, but I was saying, a lot of it, and it's okay because I profit from it, right? Which is that a lot of it is they're trying to make sure that their expenses don't go up. It's cheaper to go get somebody a test right?
Well, and
Than
I
them
don't,
having to,
and I don't have a problem with it. I think that
yeah,
a business that is being run effectively and efficiently and within the healthcare
right.
system will recognize that preventative medicine in the long run is much
Yeah,
more cost effective than waiting
that's
till
right.
somebody has a traumatic situation or a
Thank
serious
you.
disease and having to treat that.
Yeah,
I think good medicine can
yeah.
be good business, and I think Kaiser,
Mm-hmm.
from my understanding, is doing it
Mm-hmm.
better than many other
Yeah,
systems.
yeah, yeah. I would tend to agree. I would tend to agree. They're like any business. It's got its certain things that you're like, oh, really? but
Well,
but
the
that's
reality is
that's part of being in business.
there's no perfect system, which is
No,
why it's really important that people become educated about what they need,
thank you.
about their
That's right.
bodies, about their health,
That's
so
right.
that they can advocate for themselves. In my book, Fracture
Yes.
Proof Your Bones, repeatedly in the different chapters, I'm providing questions for people to ask their doctors
Mm,
so they can make sure they're getting the
okay.
best information
Yeah.
so they can make the best decision. There is a
Mm-hmm.
concept I review in the book, and I think it's important to mention here, called
Uh-huh.
informed consent. Every doctor learns about the concept of informed consent. Informed consent
Mm-hmm.
means that you have told the patient what the treatment option is,
Mm-hmm.
what an alternative to that is, what the risks are, so that
Mm,
the patient can make the best choices for themselves. The
right.
challenge is when it comes to osteoporosis, most doctors, when it comes to their recommendations, they're only treating the number on the test, a bone density
Oh,
test.
okay.
But the reality is, the most important question to ask is, well, if that number changes on the test or with that test result, how well does that predict my risk for fractures? Because that's the most dangerous
Mm,
thing with the disease.
mm-hmm.
We've known since the 1990s that a bone density test predicts less than half of people who will actually break a bone. For
Oh,
women, we've known since and men since I believe the study came out in 2008 that a bone
mm-hmm.
density test only predicts 40, about 41, 44% of women with osteoporosis who will break a bone, and only 21% of men. And
Wow.
yet, that is almost exclusively what is being treated is the number on the
Yes.
test. Every organization that's looked at the data has correctly concluded that fracture risk is predominantly due to other things besides bone density. Bone density is just one small piece. It's an important piece of the
Ah,
puzzle, but too often it's
interesting. Okay.
overemphasized.
Yeah,
And
that's the
so,
only. Yeah.
right. And so, what I like to educate people about, no matter what the recommendation is, it's a medication, for example. The question is, has it been shown to reduce my risk of a fracture in somebody with my medical history?
Okay.
Meaning, if you've
Okay.
never had a fracture before, does it prevent
Uh-huh.
a first fracture? What the research shows and the studies show, the most common medications to be prescribed, the oral bisphosphonates, for example, do not prevent both a vertebral and hip fracture if you've never had them before. And a hip fracture is the most dangerous. So they
Okay.
have been shown to prevent a primary or first vertebral fracture, but not a hip fracture. And so most doctors aren't aware of that. They're just prescribing these medications and they see the bone density test results go up, and the doctor's happy, the patient's happy. So everybody goes away happy, and the patient is woefully underprotected or not protected. In fact,
Yeah.
more recent study came out and concluded that the changes in a bone density test are not a good indicator for
Mm,
whether or not an osteoporosis medication is going to be effective at preventing a fracture.
okay. Okay. So are there a number of different medications and
Mm.
that are for particular parts of the body or for overall or I mean what is
So not for particular parts of the body, but there's some
okay.
medications that are better than others in certain situations. So if
Okay.
the only medication that's been shown to prevent a primary
Uh-huh.
hip and vertebral fracture, that means if you've never had one before, is intravenous Zometa. That's a bisphosphonate, intravenous bisphosphonate
Okay.
called Zometa
Uh-huh.
or zolendric acid. Now, if you've had a fracture before and you're
Is
trying to
that like
prevent
anywhere or
an
just
osteopor
those places?
anywhere, an osteoporotic fracture in your arm, your wrist, your
Oh,
leg,
okay.
and you're
Okay.
trying to and you've already had one, you're trying to prevent a second or third
Got it.
fracture with osteoporosis,
Okay.
then what the research shows is those medications are more effective at preventing subsequent fractures from occurring.
Okay.
And there are different types of medications and they have different mechanisms of actions, and so some of
Hmm.
them are more effective at preventing fractures, some are less effective.
Okay.
The side effect profiles are different. There's a whole chapter in my book on osteoporosis
Uh-huh.
medications that can
All
help people
right.
get the information to make the best decision, but there's things that they can do beyond medications with
Mm-hmm.
diet, lifestyle, exercise, dietary supplements to promote bone health, to
Mm-hmm.
improve their bone health, maintain bone strength, and improve their bone density.
Mm-hmm. So that makes a lot of sense. I mean, I've only had one fracture in my life, and it had nothing to do with osteoporosis. It had to do with tripping and landing on my shoulder, and it broke my collarbone. Um, so you know that was not that was just because of how I fell, and yeah. Um, so, but I guess what came to mind when you were talking about that is that, and I know you wrote a book, but we can't send the book to everybody for free. um, although maybe
But
we
it
can
is a
get you to
good
talk to
investment in their
Kaiser,
health.
and they
But I do
can
recommend
send it
people
out.
get a copy of the
Yeah.
book because
Oh
it is
no,
an important investment in their health.
I totally agree, and I'm gonna go buy it when we're done for sure. Um, now I lost train of thought. Anyways, okay, let me ask you a different question. Is is there any kind of like, for instance, my mother had osteoporosis. Does that make me at higher risk for having it?
That
Or
is a
is
great
the
question. So in the list of risks for osteoporosis, a family history of osteoporosis is on that list. So if you're a woman and your mother had osteoporosis, and I talk about this in the book, that
Mhm.
is a risk factor for you getting osteoporosis. However, some people may conclude, oh, well, that means it's inherited. It's just genetic. Well, there
No.
are no genes that have been discovered that
Oh.
can predict that somebody is going to get osteoporosis. There's no causal
Mm-hmm.
effect that have been. There are many genes involved in bone
Mm-hmm.
health. It's a complex tissue. What we do know, however, is that lifestyle and diet and exercise are inheritable, meaning studies have shown that typically people grow into adults and adopt the diet, lifestyle, and exercise patterns that they were raised with as children. And that may actually be what
Oh.
is inherited, because what we
Okay.
know is that the older we get, the more important diet, lifestyle
Yeah.
are to the development of chronic diseases than genetics. And so it's really modifying those
Okay.
behaviors that is more
Interesting.
important than whether or not your
Uh-huh.
mother had it.
Interesting. Interesting. Okay. So that makes a lot of sense, actually. Um, you know, for all the things that that have been coming out with being recommended as far as exercise and what you eat and all of that makes a lot more sense than it being
And what we know is a
inheritable
standard American diet is a risk factor for osteoporosis. It tends to be high
for
in packaged,
everything.
yes, for everything: heart disease, diabetes, cancer,
Yeah.
dying early, for all of that, and for
Yeah.
damaging bone and osteoporosis.
That
And
makes
that is
sense.
high in packaged foods, pro-inflammatory foods, low in micronutrients like vitamins and minerals that our bodies need. In fact, when you're eating flour, grains that have been processed into flour, that refining process strips away, 80% of the B vitamins and, 60, 70% of the minerals from that's in the natural whole food. And so
Hmm.
just switching into a Mediterranean dietary pattern, that Mediterranean plant forward diet with plenty of protein, that
Hmm.
dietary pattern has been associated with 20% reduction in osteoporosis and a reduction
Wow.
in fracture risk. So diet
Wow.
is a huge determinant of health. And as people, I'm a believer of let's control what we can control. You have to
Yes.
eat every day. So you're either eating with every forkful, you're either feeding your disease or
Yeah.
you are promoting and boosting your health. And so moving towards a healthier diet, if you're not already there, is crucial, not just for bone health, but for every aspect of our health. Exercise, crucial. Moving your body. You
Hmm.
don't have to go to the gym and pump iron. There have been studies
Okay.
showing, qigong and yoga
Uh-huh.
can
Uh-huh.
improve bone density. But even
Wow.
walking, there's this myth out there
Yeah.
that you have to walk 10,000 steps a day, which for me always felt a little overwhelming. I kept
Yeah.
looking for the research, and finally somebody decided to study it and say, hey, is this really true? It's not true. In fact, I laugh. I'd be thinking back when I heard about this.
Uh-huh.
That recommendation of 10,000 steps a day was invented by a Japanese watch company looking to market their watch. It had nothing to
Oh
do with science or physiology or medicine.
no. Or
What the
anything.
research
Yeah.
shows is that if you walk an average of 7,000 to 7,500 steps a day, there is a
Uh-huh.
decrease association with a decrease in all-cause mortality of 50 to 70%. It seems to
Wow.
plateau the benefits at 7,500 steps a day.
Okay.
So it doesn't
Okay.
have to be 10,000 steps a day. Just getting out and walking is fantastic.
Yeah.
Parking,
Yeah.
and it's cumulative. It doesn't have to be in one setting. Parking further away in the parking lot from
Oh
the
yeah.
door
My
to the
husband's,
store. It's
that's his favorite.
wonderful.
Yeah. Yeah.
95% of fractures occur because somebody falls. So anything we can
Yeah.
do to reduce the risk of somebody falling is important. So balance exercises are important as well. I
Ah.
like the stork exercise for people, and that is storks, as you may know, are famous for standing on one leg. And
Yeah.
what you can
That's
do
true.
while you brush your teeth is just, and I'm doing it now, you can't really see, stand
Uh-huh.
on one leg while you brush the bottom teeth. That's 1 minute, right? And then you switch to the other leg for the second minute, and you
Uh-huh.
do that. So that's 2 minutes total. You're working a little bit of your core muscles, your stabilizers in your pelvis and your legs,
Okay.
and you're
Okay.
improving your balance. And you can do that twice a day. Hopefully you're brushing your teeth twice a day.
Oh
And you can
yes. Oh
steady
yeah.
yourself on the sink if you need it, on the counter for a little while. But
Yes.
then
That would be smart.
when that becomes easy to do, switch
Hmm.
to your non-dominant hand and test yourself, give your nervous system a bit more of a challenge. And
Uh-oh.
so there are simple recommendations that I provide in the book and I provide in
Uh-huh.
blogs on my website, that how
Yeah.
people can work exercise into their daily
Okay.
routines. And it's important to
Okay.
know that if you have osteoporosis, exercise can actually be dangerous. It can increase your
Mm.
risk for fracture
Mm.
if not done
Mm.
correctly. So finding somebody, if you're going to work with a trainer who
Mm.
understands how to work safely with somebody with osteoporosis, is important. Or getting some extra resources in the terms of books or guidance is important. So we talked about, diet. We talked about exercise.
Yeah.
Getting enough sleep is oftentimes not discussed when it comes to osteoporosis. But
Or
what
a
we
lot of
know
other
is,
things. Yeah.
or a lot of other things, sleep deprivation, insomnia,
Hmm.
not getting enough sleep will increase blood
Yep.
pressure risk, diabetes risk, heart disease risk. It also increases the risk for osteoporosis. So making
Okay.
sure you're getting enough sleep is
Yeah.
important. Making sure you have social connections, that's often,
Mm.
again, not talked about. There's been an associate studies have looked at this issue with bone health and shown that if somebody has strong social connections and a strong social network, if they do fracture, they heal faster from the fracture and they're less likely to get
Interesting.
osteoporosis. So
Uh-huh.
that is an important piece of the puzzle from a holistic point of view. And then, of course, there are nutrients, dietary supplements that clinical trials have shown can not only boost bone density, but as I
Hmm.
mentioned before, bone density is not a great marker of bone strength, but
Right.
also maintain strong bones as indicated by fewer fractures in clinical trials.
Ah, okay.
And
Okay. Like,
so there, well, great. So there are only 4 nutrients that have been shown to do that. Calcium and vitamin D
okay.
have been shown to reduce fractures by about 18 to 23%.
Okay.
There's a specific form of vitamin K2 called MK4. People
Yep.
who are familiar with bone
Oh,
support
MK for not
dietaries,
MK7,
and I was going to
MK4.
mention it, right. So there are 2 forms found in dietary supplements,
Yeah.
MK7 and MK4. The clinical trials on MK7 shows that it slows down the loss of bone density, but doesn't increase bone density. But more
Okay.
importantly, there are no studies, zero, with fractures as the endpoint in the clinical trial, showing that MK7 actually maintains strong bones as indicated by fewer fractures. In
Okay.
contrast, MK4, also a form
Uh-huh.
of vitamin K2, but they're
Yeah.
not the same molecule. They're different. They
Right.
have different molecules, so they have different activities in the body. There are over 25 clinical trials with MK4
Mm.
showing repeatedly that not only does it promote healthy bone density and can increase bone density, but there are 5 clinical trials at least that have looked at fractures as the endpoint for bone
Mm.
strength and shown that MK4 maintains strong bones as indicated by up to 76% fewer fractures in clinical trials. There have been
Wow.
3 meta-analyses that have pooled the data and looked at this as well and
Uh-huh.
concluded that MK4 is the only form of vitamin K2 shown to actually maintain bone strength. MK7 has not been shown to do that. And it has to
Yeah.
be in the dose of 45 milligrams per day. That's what's been studied. It's been so well
Okay.
studied that since 1995, it's been approved by the Ministry of Health in Japan for bone health.
Wow.
And then the 4th nutrient
Uh-huh.
is strontium.
Okay.
Strontium is available in some European countries as a medication in the form of strontium
Uh,
ranelate. In the US,
right.
it's available as a dietary supplement, typically in the form of strontium citrate. There are no clinical trials on
Mm.
strontium citrate showing that it is safe or effective. Now, it may be effective and it may be safe, but all we have are the clinical trial data on the strontium ranelate. And so let's
Mm-hmm.
talk about that. There are 6 clinical trials that have been published on strontium ranelate
Mm-hmm.
for bone health and looked at fractures. 5
Mm-hmm.
of the 6 trials showed that it only prevented fractures of the spine. It did not prevent fractures of the hip. Only one
Okay.
study also showed hip fracture prevention. So the majority of the data shows, similar to the medications, that they don't prevent both vertebral and hip fractures.
Interesting. Okay.
But also important with the strontium is that it creates false bone density test results. So it's a mineral. It's heavier than calcium, so it incorporates into the bone.
Uh-huh.
And the bone density test is an x-ray. The x-ray goes into the bone and bounces off the minerals. The angle at which it bounces off the
Oh,
minerals is called the refractive index, and the machine picks that up and it creates its mathematical magic and spits out the results in the form of a
wow.
t-score.
Okay. I never
But
knew
it
what it
can't
was. Yeah.
correct for strontium in the US because it's not a medication. It's not part of their
Uh,
the machine algorithms. And so
mhm.
the bone density tests are not accurate. Now, despite the limitations of the bone density test, I personally want them to be accurate. It is an important piece of information. Also, importantly, with strontium, a review of the safety data of strontium ranelate was conducted and published. They looked at European regulatory data and clinical trial data, and they determined that for every one person that was helped by preventing a fracture with strontium ranelate, they expect one person to get a dangerous blood clot that can create a pulmonary embolism, a stroke, or a
Oh,
heart attack.
gross. Okay.
And
So maybe not that
for
great
that
to
reason, I
do.
am not a fan of strontium for all of those
Okay.
reasons.
Okay. Interesting. Okay. Well, we'll stop taking that. Um,
And
so,
frankly, to get the benefits
right.
that incredible 70+% improvement or maintenance of bone strength
Hmm.
with the MK4, the only other nutrients that were used in those studies was calcium and vitamin D. So
Okay.
magnesium,
Okay.
which is commonly found in the bone support dietary supplements, it's never been shown to maintain strong bones. Boron, never been shown to maintain strong bones.
Mm.
Now, those are important nutrients and they're important to
Yeah.
get through
Yeah.
diet and maybe through a
Right.
multivitamin. But when we're looking at what does the research show specifically targeted at the clinical endpoint of bone strength,
Mm-hmm.
it's just the calcium, the vitamin D, and the MK4 that have the strongest clinical trial data and
Mm-hmm.
safety data on them.
Okay. So let me ask you about something that I've read, and it could be totally wrong, which has to do with calcium,
Mm-hmm.
which is that it also ends up a lot in your blood vessels, I think it was.
Great point. So the safety of calcium is a really interesting question, and it's gotten a
Yeah.
lot more. I've been getting a lot more questions about that recently. Our
Mm-hmm.
current knowledge is that taking up to 1,000 milligrams a day of calcium as a dietary supplement is safe.
Okay.
The now the position statement of the Bone Health and Osteoporosis Foundation and the American Society for Preventive Cardiology is
Okay.
that taking up to the safe limit as indicated by the National Academy of Medicine of
Okay.
2,000 to 2,500 milligrams per day of calcium should be considered safe. Now,
Hmm.
the challenge for people, and what I think a lot of doctors don't even understand, the recommendation of calcium and how much to take and what's the safe amount to take, that's from all sources, both diet and dietary supplements. Now,
Yeah.
the
Adds up.
USRDA for calcium is 1,200 to 1,500 milligrams per day. There is no indication that above 1,200 milligrams per day, you get improved benefits for the
Okay.
bone. And the average American diet for a woman provides about 800 milligrams of calcium. So if someone's eating better than the average American, they're
Mm-hmm.
getting 1,000, 1,200 milligrams of calcium from their diet, and then they're taking a dietary supplement that has
Mm.
another
Mm.
1,000 milligrams of calcium in it per day. That's
Yeah.
too much calcium. My
Yeah.
OsteoK Minis product that I formulated provides
Uh-huh.
400 milligrams of calcium because for most people that should be sufficient. And in
Uh-huh.
fact, there's clinical trials with the MK4 with a higher amount of calcium and a lower amount of
Mm-hmm.
calcium. And despite the difference in the amount of calcium, the results were essentially the same. It's that
Okay.
MK4 nutrient that's really
Right.
pushing that calcium into the bones, but also activating uh, multiple genes within bone that produce bone collagen, that help
Uh-huh.
modulate inflammation in the
Ah.
bone in the body.
Uh-huh.
And so it has multiple activities, and the calcium is
Yeah.
supportive. But most women, most
Mm-hmm.
people, although the indications are currently that up to 1,000 milligrams of calcium as a dietary supplement are safe, really
Yeah.
don't need that much.
Need that much. Yeah. Yeah. So one of the things that I've read, and you can tell me whether you've seen this or not, is that the MK7 helps to keep the calcium out of your blood vessels.
So I don't know of any human clinical trials that show that.
Okay.
All right, so that is based on, there's one animal study of MK with MK4 that showed some benefit. I believe there's an animal
Mm-hmm.
study with MK7.
Mm.
I do believe that the research is probably stronger with MK7, but I still believe it's a bit theoretical than it is with
Mm. Mm.
than stronger than MK4 for that indication,
Uh-huh.
specifically for bone health. If you're looking at bone health, there is no comparison in terms of clinical
Right.
trial data.
Yeah.
MK4 is the nutrient is the form
Right.
of vitamin K2 in the dose of 45 milligrams per day to be taken.
Yeah. Yeah. No, what I read with the MK7 had nothing to do with getting into the bone. It just had to do with it getting into the blood vessels, and that's a negative.
Well,
So
yeah. So
that
it
was
activates both forms of vitamin K, activate protein called matrix glycoprotein, or
Oh,
MGP,
okay.
and modulate another one called
Okay.
MMP, matrix
Mm,
metalloproteinase. And those are involved in, especially the MMP, and in calcification of the arteries. So, like there's some
yeah.
indication that maybe benefit. There are no clinical trials,
Trials. Yeah. Right.
randomized clinical trials showing
Yeah.
that. So,
Right. And exactly. That's part of the problem, right? Is that there's all these other studies floating around, but they're not necessarily up to the, excuse me, up to the level of
yeah.
real
What we do
clinical
know, though,
studies.
with coronary
Uh-huh.
artery calcification, is that it's a
Hmm.
multi-step process, and the first step in
Okay.
that process is inflammation. Inflammation and free radicals
Ah.
damage lipids. It damages cholesterol, or damages, I should say, it creates free radical damage that damages the lining of the artery, and then that
Ah.
activates the
Okay.
immune system, that recruits cells of the immune system, macrophages, that go in and consume that LDL, the lipoprotein, the cholesterol that's
Hmm.
gone in there, essentially to patch the damage, and
Okay.
it gobbles it up, and that's what starts the process of calcifications. And so,
Ah,
really,
interesting.
the underlying mechanism of coronary artery calcification is chronic
Uh-huh.
inflammation. And again, it goes back to eating a healthy anti-inflammatory diet, that Mediterranean dietary pattern, getting
Right.
enough sleep, eating lots of fruits and vegetables,
And exercising.
and exercise.
Yeah. Funny how we always end up back
It
at
always
that.
goes back to that. Yeah, the
Yeah,
foundations.
exactly.
It's the foundations of health.
Yeah, no, no, for sure. For sure. Absolutely. Absolutely. And I think a lot of us are, what's the right word? I don't know. We fall for a lot of these articles and all these magazines with all the supplements in it
Well,
and stuff
and
like that.
one of my missions and one of my goals is to help educate people about what are the questions they can ask, so they can be
Hmm.
savvy consumers about dietary supplements. It's a huge industry, $60 billion
Oh my God,
industry in the
yes.
US. So there are
Yes.
bad actors out there, like any industry, and there are reputable, excellent companies out there. What I
Uh-huh.
recommend people look for is not that they're citing um, in vitro or test tube data or
Yeah.
molecular studies, but are they
Hmm.
citing clinical trials? Are they actually citing anything? Like, if they make
Yeah,
a
well, that too.
claim, a
First
health
off,
claim,
yes.
what's the study? Where is there a citation
Yeah.
there? And then, is it really the most relevant thing that they're citing? Is it something that's a
Yeah.
surrogate marker, which means it's a surrogate marker is a blood test. It's not really clinically the thing
Hmm.
that we're most concerned about. So, for example, cholesterol is a blood
Hmm.
class that's a surrogate marker for somebody's risk for a heart attack. A bone
Hmm.
density test is a surrogate marker for somebody's risk for fracture. Well, so, but the most important thing is, are there clinical trials on the nutrients or
Mm.
combinations of nutrients
Yeah.
for the most relevant thing that you're trying to work on, the most relevant part about your health you're trying to
Uh-huh.
support and
Uh-huh.
promote? For example,
Uh-huh.
maintaining strong bones. The
Yeah.
biggest indicator of whether bones are strong is whether or not you break a bone. That's the most
Yeah.
direct indicator. So, are there clinical trials on that? With respect then to the dosage, are they
Hmm.
using the dosages
Hmm.
in their products that were used in the clinical trials?
Right.
In fact, this whole conversation that we're having now is the underpinning and is the entire foundation and reason why I started my company, NBI, because in
Hmm.
my clinic, I couldn't find the dose or combination of nutrients in
Mm.
existing products that were
Okay.
shown to work and that I needed for my patients. And so I created the solutions to help them and to help
Hmm.
people beyond the walls of just my clinic.
Okay. Okay. No, that makes a lot of sense. I think I'm assuming that that's why quite a few doctors have started their own lines of
So I
vitamins
there are lots of
in,
reasons why
a
people do
different,
it.
yeah, different lines, right? Depending on what area their specialty is.
So like any industry, medicine is no different. There are some practitioners
True.
who are more scrupulous and there are some who are less.
That's
There are
true.
lawyers that are better lawyers and some that are worse.
Oh
Doesn't
my
matter the
God, it's
industry.
everything.
Doctors
Yeah,
are
I
no
mean the
different. I can tell
gardeners.
you,
I mean, they're all, yeah.
I know doctors who started a line of dietary supplements or just private labeled them. They
Mm-hmm.
didn't formulate them themselves. They just got it
Mm.
from a manufacturer, put their label on it,
Oh my
and
God. Okay.
marketed it because
Yeah.
they thought it was a way to create passive income for themselves. So
Ah,
just because it was started by a doctor doesn't mean the formulations are
that's true.
quality formulations. That's
Yeah.
why it goes back to evaluating what are the research studies on the
Mm-hmm.
nutrients and are they using the doses shown in the studies to work?
Right. Yeah. 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 I know the other thing that I look at a lot is Consumer Lab. I don't know if you're familiar with
I
them.
am familiar with Consumer Lab. Mm-hmm.
Yeah. Yeah. And they seem to do a lot of good work on calling out a lot of these supplements that are either don't have in them what they're supposed to have or say they have or not, don't do anything to help, that there aren't any studies behind it. Um, so that's kind of my go-to research place before I look at buying things because I buy way too many supplements as it is. Um, so okay, so are just out of curiosity, then we can kind of wrap this up. We're getting towards the end of our time. Um, are the numbers going up for the percentages of people with osteoporosis?
So
Like over the last
since a
10,
condition that
15
affects
years?
people as they age and the
Right.
population is aging, the numbers are
Yes.
increasing. But it's not just a matter of aging. More and
Mm-hmm.
more Americans are taking medications. So one of the things we
Mm.
saw during COVID is that the number of particularly women who were prescribed antidepressant medications went up.
Yeah, you mentioned that. Yeah.
So antidepressant medications, specifically those that increase serotonin, damage bone
Mm-hmm.
and increase fracture risk. And most doctors aren't aware of that. There have been
That
multiple studies
figures.
that have looked at this. Two meta-analyses that were done on all the research. One of them
Mm-hmm.
concluded that for every 19 patients taking an SSRI medication, like Prozac, for example, for 1 to 5 years, we will expect one of those people to have a fracture, to break a bone. Another study determined that it was about, I think, for every 45 or 48 patients taking it, we would expect someone to break a bone. Regardless of what it is, it's too many
Mm-hmm.
patients. So
Yeah.
anything, even the SNRI medications, those that
Mm-hmm.
also elevate norepinephrine, if it
Oh.
elevates serotonin, it damages bone because there are serotonin receptors on the cells in bones. And in fact, the
Uh-huh.
majority of serotonin is not produced in the brain, it's produced in the gut. And so when you're artificially increasing the amount of
Okay.
serotonin, it changes the balance of serotonin that's naturally occurring in the bone, and it affects the behavior of the cells, and it starts to create bone breakdown, and it
Wow.
increases the risk of osteoporosis and fractures. Acid
Oh.
blocking medications is another common medication, not on
Oh.
most doctors' radars. The proton pump inhibitors, for example, is associated with an increased hip fracture rate of about 40% after taking it for 4 years. And even
Wow.
after a year, you start to see an increase in risk. The US FDA, their first warning about proton pump inhibitors and fracture risk was back in 2010. So this is not
Mm-hmm.
new information.
Right. Yeah. No, I do remember that. Um, yeah, interesting.
And in fact, a
Hmm.
study looked at women who entered the hospital with an osteoporosis fracture. They looked at the medications they were taking in the 3 months before they broke a bone, and then the medications they were taking after they were discharged from the hospital.
Uh-huh.
And they were wondering, okay, did the medications that increase their fracture risk, were they taken off of them? Was there
Mm,
a benefit when they left the hospital because their medications were changed? What they found was over 70% of the patients who broke a bone were taking
mm.
one or more medications that increased their osteoporosis or fracture risk. And when they
Mhm.
left the hospital, some of them were taken off of the more common medications that are known and
Okay.
most physicians known damage bone, like prednisone. But then
Mhm.
they were put on other medications that increase osteoporosis and fracture risk. So overall, there was no net benefit. It's a
Wow.
huge blind
That's
spot
too
within the
bad.
medical community. So that's why in my book, there's a whole chapter on medication induced osteoporosis. So people can talk to their doctors about it. You need to check your
Yeah.
medicine cabinet. Say, look, are any of these medications on the lists that have shown to damage bone? Because you may be able to
Hmm.
take a lower dose or switch to a safer medication. Not all types of antidepressant medications have been found to damage bone. So there are
Oh,
safer ones to
interesting.
take if you
Okay.
need to be on a medication, but also if you
Okay.
work with a naturopathic doctor or a functional medicine
Mm.
doctor, or look at nutritional medicine and ways to
Yep.
deal with mood. There may be ways to actually get off the antidepressant.
Right. Right. Yeah. Well, and for some people, my mother included, um, putting her on those medications were just like they threw her over the cliff. Every time they would try and put her on one of those medications, she can't say it any better way. She would try and kill herself, literally.
On an antidepressant medication, well, it wasn't a good fit for her. Look, these
No, it
medications
obviously was
should
not. Yeah.
these medications, when used properly, can be absolutely
Oh, yeah.
life-saving and
Yes,
an
I
important
agree.
therapeutic approach. But it's like
I agree.
anything. It's not Every medication is not a good fit for every patient in
Yeah.
every situation.
Oh, no, and I totally agree. I totally agree. You know, but I'm just saying, but everybody, I mean, and I have reactions to medications as well, you
Yeah, well,
know.
but the
So,
challenge is,
and
I
that's
think, as a consumer of medicine, most people are going to a conventionally trained doctor in a
that's
conventional
right.
clinic, and really
That's right.
that's all they have at their disposal. It's
Yeah.
drugs or surgery primarily,
Yeah.
and they're not
Yeah.
trained in nutritional medicine. They're not trained and educated to have these more complicated,
Hmm.
nuanced conversations,
Yeah.
or understanding what are the gold standards in testing, because there are nutrient deficiencies that are associated with depression, and
Hmm.
nutrients that can be tested for and corrected if they're
Hmm.
deficient and they're not being
Hmm.
tested for. And this
Yep.
is
Yep.
actually a good topic to really bring in about osteoporosis, because a study
Hmm.
was conducted in Europe a few years ago that asked the question, how do doctors feel about treating osteoporosis? Why is it so undertreated? Why are people not getting screened for it? Over there, it's not being screened for well enough, just like in the US. But
Hmm.
what they found, and I don't believe it's any different, is the doctors in the European country that they looked at
Hmm.
said that they weren't sure how to interpret the test results. They weren't
Mm.
sure which medications to use are best. They weren't comfortable
Yeah.
having conversations about diet or dietary supplements or exercise,
Hmm.
and because it was outside of their
Yeah. Yeah.
education. And
Right.
also, then there was pressure to see a lot of patients during the day because of reimbursement and how they're paid, what the
Yeah.
financial structure of the healthcare
Yeah.
system is. And
Yes.
having these conversations about diet, lifestyle, other holistic things people can do, it takes time. It doesn't fit neatly into a 12 or 15-minute appointment. And so, for all those reasons, and I don't believe it's any different in the US,
No,
this
it's
is
the
a
same.
tragedy that is unfolding and continues to unfold, where people
Hmm.
are not getting screened, they're not getting treated appropriately, they're not having the necessary conversations with their healthcare provider, or getting the information they need to be as protected and proactive as they can be, which is
Yeah.
why I was so passionate about putting my head down for over a year and writing this book to get this information out.
Hmm. Yeah. No, I totally agree. And it's not a new, it's really not a new situation. I mean, I think the last 30 or 40 years it's been pretty much the same, and if nothing else, just getting worse.
Yep.
Unfortunately, unfortunately. So on that happy note,
Well, the happy note is there's a lot of things people can do. There,
yes,
you
yes,
can be empowered.
yes.
There are ways that are backed and informed by the research where
Uh-huh.
you can improve your bone health. You can
Yeah.
reduce your fracture risk. You can take charge of your own health.
Mm-hmm.
And the
Mm-hmm.
beautiful thing is that all of these strategies that are holistic, that
Mm-hmm.
improve bone health, they also have been shown to be healthy for your heart and for your blood sugar regulation and
Ah,
for your brain. It
uh-huh.
is it helps all aspects of your body.
For sure, for sure. And I'm sure as well that the mainstream medical is not, would your regular doctor would be very happy to have that kind of help
People are
in
taking
giving
my
them
book
more
with them to their
information.
doctor's
Yeah,
appointments. They're
right.
saying how that their doctors are happy to have the conversations with
Yeah,
them. They're grateful to have the information. I have doctors who are buying the book and putting that in their waiting room for patients to read
good,
while they're waiting.
good.
I'm being invited. There are about, I think, 6 medical conferences that I've been invited to speak
All
at just
right.
this year, to help
Uh-huh.
get this information out, help doctors
Good.
understand what they can do better. So
Mm-hmm.
both from the consumer point of view and from a professional colleague
Yeah,
perspective, I'm trying to move the needle.
absolutely. Absolutely. And I didn't mean to demean the regular AMA medical
So
doctors.
the AMA is
They
not
just don't have the,
are not doctors in on the ground. The majority of physicians in this country are not members of the American Medical Association.
oh,
My
okay.
colleagues
I
who are
didn't realize
conventionally
that.
trained
Uh-huh.
doctors overwhelmingly have their heart in the right place, want to do
Yeah,
good work, but
right.
they're hampered by their education. We all have blind spots in our
Yeah,
education, right? I
of
do too.
course.
Everybody does. But more and more, they're wanting to practice in integrative settings. They're
Mm-hmm.
wanting to learn more about this information. The
Mm-hmm.
healthcare setting, unfortunately, the financial model of healthcare is still not to the point where it can be truly integrative medicine, but
No,
hopefully
it's
it's
true.
moving more and more in that way, in that
Mm-hmm.
direction. But my MD and DO colleagues who are practicing in the conventional healthcare system are grateful when they have this information.
Mm-hmm. Oh no, I agree. I agree. I mean, I would agree that the majority, vast majority of people who go into medicine are doing it because they want to help people.
Yeah, their heart's in the
Um,
right place for sure.
yeah,
They're good
yeah,
people.
yeah, yeah. No, no, I agree, and I was not trying to say any differently. It just takes a little while to find one that you get along with. I've
Well, and
found.
that's an important point because it is a service industry, right?
Mm-hmm.
And so I also tell people, look, not everybody is like, I'm not everybody's cup of tea, and that's
Mm-hmm.
okay. You need to find out who who you jive with, who you
Yeah,
resonate with. And if you're
that's right.
not getting the service from your practitioner, then fire them. Like, that's your right. You're the consumer. They
That's
work for you.
right.
I see it when with patients that I've worked with,
Yeah,
I see it as I'm their employee. I'm working for them,
yeah,
right? And my job is to help them. And
yeah.
so if you're not getting the service and the help that you want, it's up to you, because nobody's going to
That's right.
advocate for your health as well as you
That's
can,
right.
to go and find
Thank
some
you.
the resources and the people that will give you what you need.
Yeah. Oh no, I totally agree. And I think
Now,
that a lot of people don't think that they're allowed to do that
but getting what
somehow.
you need, and here's a little anecdote, may
Uh-huh.
not always be what you want to hear. Well, I had a
That's also
patient years
true.
ago coming to me who
Uh-huh.
had a cardiac issue,
Uh-huh.
and he wanted me to fix it. He assumed I'm a naturopathic doctor, so I would give him some alternative,
Yeah.
and he got very angry with me because I looked at his EKG. I looked at the notes from the cardiologist that he brought in. I looked at the diagnosis. I looked at the severity of the condition. He was
Mm-hmm.
being recommended surgery by the cardiologist, and I
Mm-hmm.
told him he needs to go have surgery or he's going to
Mm-hmm.
die. It was that serious. There was nothing I
Uh-huh.
could do.
Yeah.
And he was actually having symptoms of cardiac issues that could have been
Oh my
fatal, and
God.
he was
Yeah.
not wanting to go have surgery. So he got angry with me, but I told him what the truth was.
Yeah.
That's different though from a doctor saying to you, you go in with a diagnosis of osteoporosis, or a doctor saying to you, diet doesn't matter. I've had literally, I had a surgeon once say to me, it doesn't matter what people eat. That's a red flag because that's just not based on the research, right? But if
Yeah.
you're not getting, you're always entitled to go get a second or a third opinion. It may be that the first opinion was correct, but if you think
Yeah.
that there's other options out there, go look for them.
Yes. Yes, exactly. Exactly. And sometimes you want to do that even if you do believe the first one, just because.
Sure.
Depends
Yep.
on what it is, right? How
Yes.
serious.
And there are things, right? I mean, the cardiac issue that I mentioned, that was a
Hmm.
serious emergency type issue.
Hmm.
What I write about in my book, and I tell people with osteoporosis, is it's scary to get a diagnosis of osteoporosis. And I get people all the time coming to me, they're afraid, they've just got their bone density test results. The first thing I do, or one of the first things I do, is ask them to just take a breath, say, this is not an emergency. There is time to educate yourself, to learn the
Right.
information, to put together a holistic plan, and
Hmm.
get the information you need to make the best decisions for yourself. This is
Yeah.
not an emergency.
And turn it around.
And turn it around. Absolutely.
Yeah. 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 No, I totally agree. I totally agree. And if you ignore it, that's not a good thing.
Not a good thing at all. No.
Yep. So want to thank you for sure. This has been full of enlightening information. And I have to say that I have spent a lot of time over the past probably 15, 20 years, reading about osteoporosis, and I've learned a lot from our time together today.
Good.
So I will definitely be going out to get your book. Um,
Wonderful.
and also to say that, and I always feel funny saying this, depending on who my guests are, is that this is not to be seen as medical advice because I'm not given any medical advice here.
Yep.
And
Absolutely. People
that
should consult with their doctors.
that's right. That's right. Exactly. Exactly. And usually I say neither of us are medical doctors, but you have a pretty good claim to say
So
that
I'm
you
not a
are,
medical
but
doctor, but
not
I'm a
for this.
licensed naturopathic doctor. I'm
Like,
licensed
there we go.
to
Okay.
practice medicine in the state of California and diagnose and
Yeah.
treat. But no, I'm not a medical doctor. I'm a
Yeah.
naturopathic doctor.
Yeah. Yeah. And this is still just a podcast. This is not,
That's
you
correct.
know,
But people can go find out more, learn more.
yeah.
There's lots of free health resources, blogs, information on there that they can take to their doctors, that they can
Uh-huh.
help learn what they can do for their own health as well.
Yeah.
On my website, nbihealth.com. So people can go find out more. I get more information there as well.
Good. I was just getting ready to ask you what your website is. I will put that
Wonderful.
in the show notes. Um, so along with a link to the book. Okay. So as I usually end up saying, which is that I will be seeing everybody next week.